Welcome back to Your Carolina. We are live from our Michelin on Main studios in downtown Greenville, and appreciate you letting us in your living rooms. We got some great information for you. We've been talking about this all week, answering some dental questions because we all have them, and sometimes we don't always have access to a dentist. I hope we really help you out with this segment. From Greenville, Dr. Daniel Nickles joins us.
Hey,
Welcome
good morning.
to the show.
Thank you so much. I'm doing great. How are y'all doing this morning?
We're fine. You're going to really educate us, and I know implants.
Implants.
That is an alternative to those bridges and whatever else people
Yes, I think it's probably the best alternative.
Why is that?
An implant is I'm going to let you hold one of these, and you can show one. I brought one for you also.
I know what these
It's
are.
a screw.
It is a titanium screw
Yeah.
that has been specifically designed to replace the natural root of any missing tooth.
So when this tooth goes in, it's like a real tooth again.
It's your second chance. It gives you your real tooth back. And then we place a crown on top of that, and you're finished.
I don't think I'm going to get in too much trouble because I think he's not at home this morning. But my father-in-law was an NHL hockey player, and he has these.
Absolutely.
And works really well. Tell us a little bit about the technology past this.
As far as
once we get the root established.
Once you, and I'm going to actually let Jack, if you want, I'm going to let you place one this morning.
Okay.
Oh, wow.
There's an implant driver.
Call me doctor, will you?
Okay, Dr. Jack.
Thank you very much.
We just place the implant right on there.
All right, goes
here
right
on the driver.
Right.
Absolutely.
I hope it's magnetic.
Okay. I'm going to close our live chat computer down for a second.
And this is just what we call a typodont. Somebody's previously lost a tooth.
We put that in there.
Created the hole. Jack, just place it right in there.
So it literally goes. I'm going backwards.
No, turn the other way.
Righty-tighty, lefty-loosey.
Righty-tighty. But it literally, with sedation, and relatively painless, it goes into your gum, your bone.
We place it right into the bone. And one thing, about bone is bone does not have any filling in itself. It's a little bit like wood.
Right.
So we place a screw in there. And we'll come back and we'll place a crown on it, and you have something of this sort here to where the implant is placed. We place the crown over that, and you're done.
Well, Daniel, let's talk expense. Okay, there is those of us that have insurance and things like that, but relatively speaking, how does it compare to bridges and partials?
An implant is going to run you about the same cost as a bridge.
Is that right?
Absolutely, and over the long term, an implant has a 96% success rate of lasting you the rest of your life, no matter what your age.
Well, that was going to be my question, and I know you partially have answered it there, but the durability of this versus other things.
Absolutely. An implant, like I say, has a 96% success rate of lasting you the rest of your life. So you place it no matter what age, and it's there. So, the longer you live, it starts costing you less and less. It's the most cost-effective, truly permanent alternative in dentistry. Whereas a bridge, you place a bridge, unfortunately, you'll grind down the two adjacent teeth on either side of the space.
So a bridge connects on either side to
a bridge connects, you lose a tooth, you prepare the other two teeth, and you literally just obliterate the enamel off these teeth, which I hate to do.
Right.
I'm sacrificing two teeth for, one tooth.
Right.
To make room for the bridge, you place it on here. And then, a bridge has a lifetime, an average lifetime of about 8 to 10 years. So in 8 to 10 years, you're going to keep replacing this, and this is where you start really, cost-effective-wise, you lose your money.
Well, you do, because you do it all over again.
You do it all over again.
So when we ask you who's a good candidate, I guess anybody.
Anybody who's in good health.
That has permanent teeth.
That has missing one or more permanent teeth.
Yeah.
Actually, probably, some of the best candidates are, people who are missing all their teeth. One of the sad things about dentures is, in the past, you'd wear, especially with lower dentures, you wear a lower denture. It'd flop around,
Yeah.
And now we can go in and replace 2, sometimes 4 implants for lower denture wearers, getting rid of their biggest frustration, lose floppy dentures. We place 2 implants. What we call locators.
But you put denture grip out of business to that crowd.
Absolutely.
Right. I always thought that sounded so uncomfortable.
Could you imagine having the goo in your mouth all the time?
That
can't imagine. I used to have to
buy it
for my mama.
He's saying try and take this off. You can't.
What's in there? You heard it snap. Jeez, Rhea, that's unbelievable.
Now, let's talk about the process of getting
Be sure and goggle. Be sure and goggle after you brush.
I guess they just need to set up an actual appointment with you first,
Just give us a call. We'll bring you in. We'll sit you down, for your consultation. And the way I always treat all my patients is we take a full set of x-rays. I do a complete exam.
Okay.
I answer, any questions you might have, and I will actually, just inform you of what you have going on in there. And then, I always tell the people, you tell me what you want. I'll take what you have, and we just put the two together, and we make a treatment plan specially designed for you.
Real quick question: the durability of the tooth itself. Can you bite into an apple? Can you?
That is your second. That is like having your natural tooth.
Next to the God-given tooth. That's it.
Next to the God-given tooth. That's the best out there.
But you're a general dentist, and you do teeth whitening and all the other things.
We do teeth whitening. We do veneers. We do root canals, implants. As a general dentist, I can provide you with anything that you want.
Why didn't they think of a better name than root canal? They needed an ad agency to think of a better term than root canal.
Because she had a dentist come up with it.
Well, you may be right.
Dr. Nickles, thank you so much.
Thank you very much.
Appreciate
Daniel,
it.
thank you very much.
It's great to be here.
The Scottish Games are coming up, and we want to talk to you about that. We've got a bagpiper and lots of guests in just a minute.
That's right. We do have more Your Carolina coming up. But before that, please pay special attention to the flowers that are here on our set. They are, of course, from A Arrangement, and you can find them in Greer and Spartanburg and also on the web.